How did you sleep last night? I'm going to go out on a limb and say the answer to this question is one of the biggest health metrics that we know. It tells you so much about your overall health, well-being, and mental health that it can be considered a pillar in health. Sleep is a complicated topic because in some circles we hear the importance of it, and in other circles it's almost looked down upon. In fact, I know of many corporations that will remark at the importance of their employees logging on from home at night, and they can even monitor if their employees are working late at night through their network. And so in some circles, there is almost a heroic emphasis on doing as much with as least amount of sleep as possible. Yet the data is stacked up on the importance of sleep. And when we are sleeping well, so many other things fall in place. In today's episode, I invite my good friend and colleague, Dr. John Neustadt, on to speak about insomnia. He is an expert in the neurohormonal components of insomnia and nutrient and hygiene approaches to addressing insomnia. Without further ado, I'm going to welcome my guest, Dr. John Neustadt, on today's episode. Welcome to the next episode of the One Thing podcast. Dr. Neustadt, welcome back to the One Thing podcast. It's great to have you back on, this time speaking with us about insomnia.
Oh, thank you. I had such a great time with you last time. It's truly phenomenal to have been invited back. So thank you.
Yeah, you're welcome. I had a great time as well. And we were just kind of catching up offline about the busyness of life. And, I think you and I, aren't an exception when it comes to the focus on sleep and the need for sleep and the impact when we don't get sleep on our lives. So we were just talking about how busy both of us are, and it was kind of a great intro into today's topic.
Yes, indeed. I think anybody can relate to that. So many people have busy lives with careers, or whether it's school. Even high schoolers now are really burning the candle at both ends and pressing hard for exams and homework, and definitely in college and graduate school. But when people are out in their lives and their careers and have families and kids, and that challenge with finding that balance to get enough hours of sleep and can be difficult. So hopefully some information that you and I are going to talk about today will provide some perspective for people where they really not only make it a priority, but understand some simple things they can do to improve not just the quantity of their sleep, but the quality of their sleep as well.
Yeah, so I think that's a great place to start. So let's just kind of talk about sleep. I mean, I think this is obviously a problem that a lot of people deal with. Can you kind of give us some context as to sleep disruption, insomnia, and just kind of define some key terms that we can think about while we're talking today?
Absolutely. And everybody understands we all need to sleep. Anybody who hasn't slept very quickly knows, and I think it's everyone at some point in time or another has had one or more nights where they haven't slept well, or maybe been pulled an all-nighter, that the short-term effects are really wreak havoc on our quality of life and how we function in the world. And just one night of poor sleep decreases our ability to learn information, to process new information that we're getting. It decreases our ability to recall memories and engage in conversations. It decreases ability to deal with just the stresses and the challenges of everyday life. And it definitely decreases our energy and our mood, and people just feel crummier when they're not sleeping well. And technically, there are lots of different reasons why people don't sleep well, and there are different diagnoses for actual sleep disorders. Sleeping poorly one or a few nights is not considered a sleep disorder, The most common sleep disorder is insomnia, and that affects 80 million people have some type of difficulty sleeping at some point in their life. In order for it to be an actual diagnosis, though, it has to be happening consistently for 3 months. But the health effects set in, much sooner than 3 months. As I mentioned, anybody who's experienced it will tell you, it's, one night or 2 nights of not sleeping well. And we feel it, and it impacts our relationships. But longer term, if people aren't sleeping enough, what it does is it increases the risk for diabetes and heart disease, early death, obesity, depression, substance abuse, such as alcoholism. All of that is part of the sort of constellations of not just effects from poor sleep, but in some cases, the result of poor sleep. So depression, for example, every psychiatric condition has a sleep component problem as part of it. And it definitely increases one's risk for substance abuse. Mm-hmm. 80 million people, as I mentioned, have some difficulty sleeping in the U.S., but in primary care settings, when somebody comes in and sees you and I, for example, as a patient, 70% of those primary care encounters have some sort of sleep issue involved in them. And unfortunately, patients don't bring it up because maybe they don't think it's relevant to their chief complaint, which really they think is bothering them the most. And a lot of doctors just don't even screen or don't even ask about it. So it's very important if somebody is having difficulty sleeping to make sure you mention that to your healthcare provider, but also understand how important it is to make sleep a priority. And I'm sure today we'll be talking about things that people can do to hopefully take charge of that and improve their sleep.
Yes. I mean, if you think about it, like before the invention of electricity, we would wake up likely when the sun came up, and our body we would do work. And as the day would go along, we'd acquire something that is, I think it's called sleep pressure, which kind of puts the pressure on gradually the need to sleep. When electricity came along, then it gave us this opportunity to push the day further. Then computers came along, which extended the workday. So we're kind of in a situation where those natural factors that were in place have been removed.
And our bodies they function on a circadian rhythm, and that is a 24-hour cycle. And when it comes to sleep, the hormonal changes that happen during that 24 hours are stimulated by light. And specifically, as the sun goes down in the evening, our bodies then start to secrete more melatonin. And melatonin is there to help us, among other things, but with respect to sleep, get our bodies ready for sleep. It typically starts to go up, after the sun sets. It peaks at about 10 o'clock at night, and then it decreases by 1 in the morning. It's going down. And that 24-hour cycle has been disrupted by technology. Now we have 24-hour a day artificial light when we want it. You just flip a switch and the lights come on, or you can watch television. And that stimulation really can affect how our bodies get ready for sleep, how we self-regulate hormonally, and also the quality of our sleep. If we look at computers, for example, specifically e-readers like tablets and iPads, and iPhones. The research, there's a clinical trial that came out 2 years ago, I believe at this point, that looked at the effect of people reading on their devices in bed at night prior to going to sleep versus people reading good old-fashioned print books. Mm-hmm. And what they found is the people who were on their screens in bed at night reading, it took them about 10 minutes longer to fall asleep.
Mm-hmm.
And it took them about 10 or 20 minutes longer to wake up in the morning. But even more important than that, what they discovered was it took people who were on these e-readers, on these devices, reading at night. The next day, it took them hours longer to feel fully awake and ready for their day. So it has a tremendous impact, those devices and that technology. And what they discovered, and what research has shown, is the light from those devices specifically depletes melatonin. And anyone who has been reading in bed on a phone or an iPad or scrolling on the internet or watching YouTube, whatever it is, that maybe they're tired. And I know I've experienced this. I've done this, and I'm in bed and I'm tired and I'm ready to go to bed, and I get on my phone and I'm scrolling and looking at stuff. And 10 minutes later, where I was tired before and ready to close my eyes, I was wide awake.
Mm-hmm.
And before that study, I didn't really understand the mechanism of it, but the mechanism appears to be what it's doing is it's depleting our melatonin. So one of the things that I tell people is make your bedrooms a screen-free zone.
Mm-hmm.
Don't take your phones in or your tablets into your bedroom at night. That's so prevalent. And also what a new study just found is a lot of kids and teenagers are doing that now as well, because that's what they see their parents doing. And so we need to model good behavior for the next generation, I believe,
Right.
as well, because sleep deprivation is an epidemic, and the results, the health and the psychological results of not getting enough sleep are devastating.
Right. So people are clever, and clever people invent stuff to let them have their phones in their bed without it disrupting their sleep. So there's the invention of the blue light blockers. What do you think about those?
So it's thought that it's the blue light from the devices, and great point, that actually is causing the depletion of the melatonin. So it depends on what do I think? I think it may work. I think it may not work. I would like to see a little more research on it in terms of melatonin and what it does to the body, because there's other wavelengths of light besides just the blue light. So, the picture is not necessarily, it comes down to one wavelength of light, and that's causing all of the problems.
Mm-hmm.
We know historically that we just didn't evolve to have those devices and that stimulation, that light in bed when we go to sleep. So if people want to do that and they find that they are able to still fall asleep and feel refreshed in the morning, that's a personal choice. I believe that it's just better and it's safer just to not have them in the bedroom, because it's more than just being able to fall asleep. We're not really sure still how these things may affect the quality of sleep. So there are different stages of sleep. There are two main major categories. One is, prior to falling asleep. It's called sleep latency. How long does it take you to fall asleep? And then there's obviously all the time that you are asleep. And then within that time that you are asleep, there are two phases or two general periods within that. One is what's called the non-REM or non-rapid eye movement stages of sleep, and there are 4 of those stages. Those are the non-dreaming stages of sleep. And then you get into REM, the deepest stage when you're dreaming. And so we don't really know, and being able to go through those different stages and get into those deep stages of sleep, especially the restorative deeper stages like stage 3 and 4 of sleep, are crucial for the restorative processes and the restorative benefits of sleep, to be able to do their job while we're asleep, for our body to do its job and restore and refresh while we're asleep. It needs to get into those deep stages of sleep. And so we don't really know, with the technology, even with the blue light being blocked, is are the other wavelengths of light, is the other types of stimulation from those devices keeping us from spending enough time in the different stages of sleep to have really optimal benefits from sleep.
Yeah. So
I'm a little more cautious when it comes to that.
Gotcha. Yeah, makes sense. You were talking about non-REM versus REM. So what can we kind of unpack that a little further? Like how does someone know, with today's technology, how do we know if we're getting those different stages of non-REM versus REM sleep, and how much should we typically get per night? Like how many cycles?
Right. So it depends on the age, how many cycles to get, and what the research shows. And I don't remember off the top of my head at every age, what's the optimal, that people should be getting in each one of those. What we do know, though, is that as people age, even in the absence of technology or in anything else, generally speaking, as we age, the amount of time spent in the deeper stages of sleep, stages 3 and 4, decreases. And so there's a good way to know if you're spending more time in the stage 1 and 2, which are the lighter stages of sleep, because you get woken up easily. It's easy to wake up. What I've seen clinically with that in younger patients is typically people who have chronic fatigue syndrome or fibromyalgia. They tend to be hyper alert. They tend to be under a lot of chronic stress, and that will keep them in stages 1 and 2 sleep. They won't fall into the deeper stages of sleep, and they get woken up really easily. So if you're the type of person that gets startled easily and gets woken up really easily throughout the night, or your partner tells you that you do, then that can be an indication that you're not getting enough deep sleep. And another indication, of course, is, are you feeling refreshed in the morning? Because it is those deeper stages of sleep that are the restorative stages of sleep.
Mm-hmm. Okay. Yeah. So let's kind of go into this, like looking at these two main categories of insomnia. So there's sleep onset insomnia, and then we would consider like sleep interruption insomnia, or, sort of sleep latency insomnia, I guess. If we could sort of go into some of the hormonal or neurotransmitter processes that would help someone if they were dealing with sleep onset insomnia. So just think about what's happening that when you're trying to fall asleep.
Sure. I love this topic. So the way that I think of it is there are two general phases in the night of sleep, and that is falling asleep and staying asleep. And when I speak with patients and I'm evaluating their sleep, I say, do you have any difficulty falling asleep or staying asleep? So falling asleep is difficulty falling asleep is also called sleep phase delay, and difficulty staying asleep is called sleep phase advance, meaning you're waking up earlier than you should. And as you're falling asleep, we talked about melatonin, so that's important. And it's interesting because there are different hormones that are sedating and calming. So melatonin is one of those, and GABA is another one that increases as people are falling asleep. But as you look at, when I really dug into the sleep research and the endocrinology, the hormones around sleep, and what's going on, you get into the deeper stages, stage 3, stage 4, we really don't know what's going on yet in terms of hormones being involved specifically. So the way that I think about it, and looking at the sort of constellation of sleep research is out there, is I take what we do know, and that is what helps us fall asleep and what keeps us from falling asleep. And then what helps us stay asleep that we know, and what wakes us up. And how can I use that clinically, and how can I use that in terms of what I do with formulating and creating solutions to these sorts of problems through dietary supplements to help people.
Mm-hmm.
So melatonin is very important, and GABA is very important. Glycine is an amino acid. It's also can act as a neurotransmitter. It's inhibitory, so it calms down the central nervous system. So a lot of times there are different reasons why people have a hard time falling asleep. Anxiety can be one, high stress. So that cortisol response can do it. Also, what also can happen is people are, if they have muscle tightness and they're sore, let's say their back and their shoulders are super tight, they just can't get into a really comfortable position where they can fully just relax their bodies. That can make it difficult for somebody to fall asleep. And so magnesium can be great for that. And magnesium is a nice muscle relaxant. It's a very gentle, helps relax muscles gently and naturally. And so in those cases, that might be able to be helpful. Then there are herbs that are just very calming herbs that have a long history of traditional use of them, and modern science has teased out the mechanisms by how they work as well. It can be very, very helpful, like magnolia bark extract or hops or skullcap, those sorts of things. So I take more of sort of an integrative approach of saying, okay, what do we know in terms of both the endocrinology of sleep, but what do we just know as clinicians? What do we know of how the body works and how the body can get into a relaxed state of sleep? And then once somebody is asleep, the question is, yes, we know things that can keep them asleep. So GABA can keep somebody asleep. The challenge with people just taking GABA supplements, for example, or taking melatonin and trying to stay asleep with melatonin is that's not all that's going on. And invariably what people have complained to me about is they have to take more and more to stay asleep through the night. And then they wake up with that feeling groggy and hungover feeling. Mm-hmm. They just got to shake the cobwebs out. It takes them longer to feel fully awake in the morning. And so I was looking at this a little bit differently, saying, okay, that's what keeps people asleep, but what wakes them up? So how can we work with the body's own rhythms and the body's own system to keep people from just waking up, whatever is going on with that, instead of just trying to take a sledgehammer, keep them asleep.
Right.
So what I discovered is, and it's very common to have poor blood sugar regulation, but if somebody has poor blood sugar regulation, what happens is your body will secrete cortisol, epinephrine and cortisol when you're asleep, because that'll release stored sugar. It'll break down what's called glycogen. That's a storage form of sugar in the liver and in muscles. And it'll release that into the bloodstream to increase your blood sugar. But what it also does, it wakes you up. So people typically are waking up in the middle of the night around the same time in the middle of the night. I consider that a potential indicator that they may have something going on with their blood sugar. And so I also like to work with them on regulating their blood sugar through diet, maybe trying to eat 8 to 10 grams of protein before they go to bed. And for some people, it's rare in my clinical practice, but occasionally that was all they needed. And it was beautiful because it wasn't pills or powders, it was just food. And when we can do things with diet and lifestyle, the patients and people are so much better off for it than just popping pills. But what I do like to use also, and what I've put into my formula, my sleep relief product, is adaptogenic herbs like ashwagandha, for example, which helps decrease the response to that cortisol, to help calm down the system, to hopefully help people so they're not waking up, or if they do wake up, it's not as severe and they're able to fall back asleep much easier.
Yeah, that makes sense. Yeah, I mean, I think the middle of the night awakening is probably the most aggravating and frustrating component of this issue for people, especially the one that I think has the least amount of solutions that I see clinically, and what I hear from patients almost daily. So it's great that you've thought about that. When I hear people having middle of the night awakening symptoms or having middle of the night insomnia, I always go through a little bit of a checklist. Maybe we can talk a little bit about that. So beyond the blood sugar issue, I also will ask them if they have any kind of pain disorders or reflux issues. Those often can wake people. Also problems with nocturia, urinary issues, secondary to like prostate concerns. So these are little things also to kind of weigh in. I don't know if
Absolutely.
You can comment on that.
No, you're absolutely right. And if when I'm doing an evaluation, digging deeper in terms of the waking up in the middle of the night, yes. How many times do you wake up? Are you getting up to pee, or are you just waking up? Are you coughing when you lie down? That can be a symptom of acid reflux. So you're right in terms of trying to look at the underlying cause and serve people as best we can. Those are very, very important questions to ask, and lines of inquiry to go down.
And speaking to, what you just said about the cortisol issue, it's a really like almost like you wake and you're almost wide awake, isn't it? Sort of, it's almost like a not quite a startle response when you wake up, but when people have that insomnia that's related to that cortisol dysregulation, it's almost like they wake and they're kind of more alert than you would expect.
Yes, and they have a hard time maybe turning their thoughts off. And there are different reasons for that. It may not be blood sugar. It could be that they've got just feeling stressed and they've got a lot on their minds and a lot on their plates. So one of the things that if that seems to be the case, that I think can be helpful for some people is if just make a list of everything you have to do. If you're running over everything you have to do the next day in your head, before you go to bed, get it all out so you feel organized, so you feel more in control.
Yeah.
And that sometimes helps people be able to sleep better. But what happens also is people get accustomed, the body gets accustomed to that cortisol. And there's a phenomenon that exists where if you're under a lot of stress and then you try and go to sleep, you just sit there and you stare at the ceiling. You fall asleep. And that's the cortisol. And it takes a while for the cortisol to get out of the system and for things to get, regulated back into a normal pattern, a healthy pattern. And part of what's important to that is doing things that will reduce your stress load. Mm-hmm. But also Fitbit did an amazing bit of research. Fitbit makes those wearable devices, tracking devices. They had over, I think it was 8 billion data points from their users and sleep. Mm-hmm. And they crunched all the data that they had, and they discovered the number one predictor of healthy sleep is going to bed at about the same time every night. Mm. Training your body, getting into that routine. Of course, there's all the sleep hygiene stuff that entails, has to do with making sure the room is dark and the right temperature. And research has shown the optimal temperature for sleep is 69 to 70 degrees, making sure it's quiet. But what they found is the number one biggest predictor in both men and women for good, regular, healthy sleep is going to bed at about the same time every night. And what they found is that on the weekends when people would stay awake later, and say they're on a routine during the week because they've got school or they've got work, and then Friday comes out and they go out with friends or family and they go have a good time and they're out late, and Saturday they're out late. Well, by the time Sunday night rolls around, they're sitting there staring at the ceiling. They can't go to sleep because they've essentially trained their body to stay up later. They've essentially flown to another time zone, mm-hmm. as if they've induced their own jet lag, and they've turned this social jet lag.
Right.
And so that's really important too, is just getting into that routine.
Mm-hmm. Makes a lot of sense. It's like we were talking about earlier, like the circadian rhythm and this concept of sleep pressure, which is, you wake up, you have a certain amount of alertness and energy that if you're on a rhythm and your body is on a clock that it can trust, it just makes a lot of sense that that's going to lead to, consistent good sleep patterns. Before we leave this topic of the sleep latency issue, you did something that was in my mind brilliant that I sort of searched long and hard for a long time with supplements for my patients, but you thought about this issue and you kind of came up with like a time released supplement. Can you talk a little bit about that? That's really unique.
Well, thank you for the feedback. I'm glad you're loving it, and I'm glad your patients are loving it and getting a lot of benefit from my work and what I've done. When in looking in terms of what we know about hormones and what hormones are involved in falling asleep and staying asleep, I started looking at them. We talked about melatonin, and invariably whenever somebody says I'm having difficulty sleeping and I ask them what they've tried, almost always they say melatonin. They've tried melatonin. And what happens though is they end up taking some melatonin. It may help, but then they have to take more melatonin, and at some point they're taking so much melatonin that it's keeping them asleep at night. But as I mentioned before, then they end up feeling groggy and hungover in the morning. So Melatonin actually has what's called a half-life. So all chemicals in the body have a half-life. That means how long does it take for half of the substance to be eliminated from the body? The half-life of melatonin is 45 minutes, about 45 minutes. So for ease of calculation, let's just say, let's give it an hour. Let's be generous. Let's say you take, standard common dosages of melatonin as dietary supplements, or 1 or 3 or 5 milligrams. Let's say you take a 3 milligram melatonin tablet, and an hour later, half of it's gone. So that's, you've got 1.5 milligrams. You fall asleep, great, but an hour later, you've got 1.5 milligrams left. An hour after that, 50% of that is gone. You've got 0.7. You've got 750 micrograms left. An hour later, half of that's gone, and so on. So what happens is, at some point, you wake up because you haven't really dealt with the more of the picture, the more holistic aspects when it comes to sleep. Because sleep is in our brain, and our neurochemistry. It doesn't come down to just one pill or one substance. It's a complex interaction. It's a web of interactions. I talked about magnesium and muscle tightness and that sort of thing. So it's not just necessarily melatonin. So what I did then, in looking at the half-life and how the body cycles through the different phases of sleep, and how different chemicals or different clinical things that we see with patients are happening at different times of the night, what I created is a biphasic time release tablet. And that is, phase 1 is the immediate release, nutrients release about 30, 45 minutes. And that quick release, phase 1, helps us fall asleep. Naturally, gently helps people relax and helps them fall asleep. And then stage 2, the nutrients in the second stage, the second phase, are released over the next about 4 hours to help people maintain sleep or stay asleep. And the goal then is that, so that gets us up to 4.5, 5 hours. Then over the next few hours, as those chemicals are being metabolized and broken down in the body, by 8 hours, 7 or 8 hours of sleep, they're out of the body enough, and people wake up and they feel refreshed. They've gotten a good night's sleep. If they maybe woken up in the night, they can fall back asleep easier because of the nutrients. Let's say they've got to get up to go to the bathroom. But when they wake up in the morning, they don't feel hungover or groggy. They just feel refreshed and ready for the day.
Mm-hmm. Yeah. So, I've noticed, the feedback that I've had from patients using it, and I've used it myself, is, that it really gets people through some of the night that they weren't able to get through previously. So, I think it's something that hasn't been available before. So we really appreciate that.
Thank you. And the reason I created it is, and why I do anything, and with my osteoporosis supplement, for example, I couldn't find the dose in the form of nutrients needed to help my patients in my clinical practice. So I created it, stuff that was supported by clinical trials for fracture reduction. Similar to this, I sent out a survey to my NBI customers about 1.5 years, 2 years ago, asking them what's the biggest challenges that they have. And the number one, even with all the sleep products on the market, the number one requested new product for me to research and come up with a solution for, and the number one thing that people were struggling with was sleep.
Mm-hmm. Yeah, definitely. The couple things that I just want to see if we can go into before we wrap up today is, so there's acute insomnia situations, and then what we've talked mainly is more like chronic insomnia. Acute insomnia, I would say, is more like a sudden event. Someone has like some sudden bad news, loss of a loved one or loss of a job, or if their job's on the line, and they might not have dealt with insomnia before. And so in those situations, a lot of times people will turn to Western medicine, which may be appropriate for those situations, just to kind of assure the ability to fall asleep and function at least somewhat throughout the day. Now, moving forward, if an acute insomnia condition converts into a chronic insomnia condition, then we have a whole other slew of things to worry about. So what what are your concerns about someone who stays on like Western medicine insomnia medications if they're dealing with chronic insomnia versus acute insomnia?
The research is very clear. The medications that are most prescribed for insomnia are the benzodiazepine category, or the non-benzodiazepine, or the benzodiazepine-like categories of medications. They go by names like Neustadt, Ambien, those sorts of things. That, first of all, they don't work all that well. They don't improve the quality of sleep. They may improve the quantity of sleep, but they keep people from getting into that deep restorative stages of sleep. But they also, one of the many challenges of those are, especially in the elderly, people 65 years or older, it significantly increases their risk of falling. If you are to get up at night and go to the bathroom, of falling and having a fall-related injury like a fracture. And in fact, research came out and it said the ability to you have to treat, I believe, off the top of my head, 3 times or 4 times more patients to get to benefit one patient versus to get harm. Meaning, let's say you and I don't remember the numbers off the top of my head, unfortunately, but say you have to treat 3 patients to get 7 patients or 8 patients to get benefit from it, and yet you only have to treat 2 patients to see harm. So it's become widely recognized that they're not that effective. I mean, yes, they'll knock people out short term, and that's, I think, the short term fix that you were talking about. But they also have very serious risks, and actually, if people take them longer term, they've been associated with increased risk of dementia, increased risk of cancer, and so they're not good long-term solutions, and they definitely don't get to the underlying cause of what's going on.
Right. Yeah. I mean, I think in my practice, I do, if people are dealing with the acute insomnia issue, where it's, they'll call me up and say, this really kind of sudden tragic thing happened and I can't fall asleep. I mean, I try to give them sort of all views, and then get them onto natural support if this problem converts to a chronic condition as soon as possible. I try to get them onto natural approaches.
Right. And it depends also for me on how involved somebody wants to be in their own health. So yes, there are situations that go on in people's lives that are, both stressful and tragic. And I think for people to experience insomnia or difficulty sleeping during those periods of time is frankly normal. And it is one of the body's normal, natural ways of coping with that stress and processing it. Mm-hmm. Now, people do need to get sleep. And so having something that can help them get restorative sleep can help them heal from whatever's going on as well. So that's important, whether it's a short-term medication or natural products, but longer term, I think it's important for people to look, hopefully they're willing to be active participants in their own health, look at what else they can do.
Yeah.
Is it the acid reflux or their dietary changes? The acid reflux you mentioned earlier. Can they do things like gentle yoga and stress reduction techniques that have been shown to improve sleep? Will they get rid of the devices at night? Can they reduce stress by saying no to more things? People are so overcommitted in our society.
Right.
And most of the time, there's quite a few things that people can stop doing. And in fact, I think, and I didn't invent this, I'm not the first one to say it, your stop doing list is probably more important than your to-do list.
Yeah. Yeah. And and since I'm recording in Seattle, we'll kind of leave the caffeine question for another time.
Yeah.
I don't want to lose our listener base.
That's great.
I'm just kidding. But that is another thing I think, to consider is, people who are drinking caffeine throughout the day versus cutting off at a certain hour, like earlier in the day.
Yep.
What could go wrong with melatonin or supplementing melatonin on a daily basis? Anything? I get this question a lot.
There's nothing documented that can really go wrong. And in fact, in cancer, it'll be prescribed in dosages much higher, to 20 milligrams for anti-cancer benefits. It's not addictive. It's not like the medications that can be addictive. It's not going to, it can suppress your body's own production of it, but it's not going to override it so that you can't produce it anymore. There's no long-term addictions, and it's been shown in many studies to be safe. And in fact, I think it's also important to recognize even the small dose, 1 milligram, 3 milligrams, which is still a lot more than what our body produces in the brain. The gut actually produces melatonin as well, and it produces about 20 times more melatonin than what's produced in the brain. So the role of melatonin, like many other things in the body, is not just one thing. It's not just with sleep. It modulates the immune system. It's an antioxidant. It has a lot of other beneficial things as well. So I'm not really worried about. I'm more worried about people taking too much melatonin, so that they're just waking up really groggy in the morning, and it's not really the most effective solution for them.
Mm-hmm. So on that note, like lactating females who are, lactating mothers that are currently breastfeeding, and then how about children, toddlers, infants? What's your thoughts on using melatonin or getting exposed to exogenous melatonin?
So I have 2 kids. They are now, I've got a son who's 13 and a daughter who's 10. And I've used melatonin with them since they were little. So I think that if you're relying on something every day, there's a problem. And even if it's a dietary supplement, that if you're not, and as we age, and we know that the amount I mentioned of deep sleep that people get into decreases as we get older. And so, there are people who can benefit from long-term, supplementing with nutrients longer term. But in kids, for example, if they need something more than just occasionally, you should be consulting with a healthcare provider, even though these are available over the counter, to see if you could, and ideally a naturopathic physician, because we're trained in integrative medicine, and to try and identify the underlying cause and look at diet and lifestyle, or an integrative MD. Also, there are phenomenal ones out there who share this philosophy, but really look at the underlying cause. So I'm not really worried about short-term use in either lactating women or in children.
That's great. Yeah. So those occasional really rough nights where everybody's pulling their hair out and trying to fall asleep, that could come in handy. So well, this has been really informative. Can you just tell us, just kind of in closing, some just brief take-home messages, and then also just a little bit about what you're doing at MBI related to sleep?
Sure. Take-home messages are, with respect to sleep, that the research is very clear that going to bed at about the same time every night is the biggest predictor for quality sleep. And we need about 8 hours of sleep a night. It's not just the quantity of sleep, it has to be good quality of sleep. So making sure you're going to bed about the same time every night, not reading devices in bed. Don't take your phone or your tablet to bed with you. Making sure the room is at about 69 or 70 degrees, a good temperature, and dark and quiet. Those are all important. Beyond that, ensuring that you're just taking care of yourself as a human being. That if you're feeling overstretched, overcommitted, overstressed, that you evaluate that and you possibly reframe things to take things off your plate so you can make your health priority. And that when necessary, there are excellent, dietary supplements out there. I created one because people from whom I was hearing were reporting they couldn't find things that worked well or worked consistently well for them. And so I went and dug into the research for over a year, and after dozens or so combinations, and experimenting with things, I came up with my product called Sleep Relief. People can learn more about it if they want on my website, nbihealth.com. And my whole emphasis with the work that I do is to make it all very rooted very strongly in the research, so that you don't have to take my opinion for these things. There are hundreds of research studies and citations on the website. So yes, people can believe me, or they're welcome to go and dig into those studies. I have every study that's cited on there. If anybody wants the actual file, the PDF file, just reach out through the website. All those go to me. If you want to ask me any questions, they can go to nbihealth.com and fill out the online form, or call the toll-free number, and all those messages will get to me. I'm happy to share any of this research with anyone, because one of the things that I'm also very passionate about is just helping educate people so that they can take better care of themselves and their families.
Great. Well, it's wonderful. Thanks for being on. I'm motivated right now to have a really good night's sleep tonight. So I think this served its purpose. It got me kind of focused and locked in on my own what my own needs are. So I hope I'm confident I did that for others. So thanks for being on again, and I look forward to catching up down the road.
Thank you so much for the opportunity. Great speaking with you.
Same here. Take care.
Thank you for tuning in to this latest episode of the One Things podcast. I would love for you to let me know how you're enjoying the episodes by liking and sharing these episodes. Please like or subscribe to the episode in your favorite podcast player, whether it's iTunes, Stitcher, or Spotify, or any of the other podcast players. We are likely on those networks. Please share these episodes widely with your friends, family, and colleague members, because let's face it, it's really hard to get good naturopathic, nutritional, integrative medicine knowledge. There's a lot of information being shared out there, but when it's coming from the mouth of someone who's been in the trenches and has gone through formal training, it is something that you can trust more. And I want this information to get out to people, because there's not a lot of access to this information throughout this country and throughout the world. So thank you for supporting this mission. And I hope that you're learning as much as I am, and that it's improving the health of you and your loved ones. And we'll see you next time on the One Thing podcast. This is Dr. Adam Rindy signing off.